Hello all, my name is Lina Lara and I currently work with at Care Integrated Behavioral Health at Christus Spawn Memorial. I have been in the inpatient behavioral medicine setting for about 5 years now, and prior to that I worked in an outpatient setting in a community mental health facility. Today I will be going over supervision within the integrated settings, and this is going to be for students and for potential people that want to supervise students in this setting. So this setting will be going over a lot of different things today, and I hope it's informative, I hope it's useful, and I hope it gives you a better understanding of what it's like to supervise students in this setting and also to be a student in this setting. Integrated settings allow for multiple opportunities of growth. This setting allows for one to fully understand diversity of a mental health care system. Supervising students in this setting is both rewarding and challenging. Some of the topics that we'll be going over today will be identifying roles, units, communication and regulations, student roles, learning, supervision process, and the challenges of supervising or being a student in this setting. Understanding who is who in an integrated system is important in this setting due to a multitude of information being exchanged between all of these disciplines. Students will need to be able to identify the hierarchy and function of these roles, and supervisors will need to be able to explain these roles in a way that is applicable to the student and allows them to grow as they continue on in the site. Physical environment and proximity is important due to different things happening in different places. There's a formal sometimes or an informal process for patient care and therapeutic interventions. Multidisciplinary team. In the integrated setting, you run into a lot of different people that play different roles. Maybe, psychiatrists, you have nurses, you have counselors, you might have a social worker, you have very different ones, and all of them are not going to always be the same. The one that I gave an example of on here is basically what we have in the inpatient setting side of a hospital. So as you'll see, the psychiatrist, the medical physicians, psychiatric nurse, practitioners, registered nurse, licensed vocational nurses, counselors, social workers, and mental health techs. And everybody plays a role in the unit. They all have functions, and the primary goal to remember for all of these is for individuals to reach a level of function where they are able to be in the community and not need to be hospitalized. So this right here kind of breaks down what the different multidisciplinary roles do in the inpatient setting. And it would be a good idea for supervisors to break this down for the students. One thing I've encountered is that a lot of times students are not aware of what the psychiatrist actually will do, or not aware of what the nurse's role is, and as they go through the site and as they're engaging with patients and providing care, at one time or another they're going to have to talk to these other people that are in these roles. So it's very important for them to know what exactly do these roles do. So as you can see, I've listed the main ones for the hospital and the inpatient setting. Of course, they could be different for different integrated settings. Okay, there's just a few other roles that we have in the hospital. In our setting, in the inpatient setting, we do work a lot with police, sheriff's department, the ER staff. And this kind of gives you the layout of the site that I currently supervise at. So this is it's called Psychiatric Evaluation Services, also known as PES. As you can see, the layout, patients are in very close proximity to each other. The space is not your typical traditional setting behind the desk. And this can also take place in a community mental health facility where you have patients gathered in a waiting room waiting to see someone. Of course, they do speak with someone privately, not in the open. This slide here shows the inpatient psychiatric units. There's just a lot of, different areas. There's a nurse's station down on the bottom right. As you can see, it's kind of very open format. As you'll notice, there's doors almost in every picture, and that's because these units are primarily locked at all times due for, just for patient safety. As you'll notice up in the left-hand corner, there's a shot of the cameras that we have there. Everything is very monitored, and that's like for patient safety, security reasons, for staff safety. And so it's very important to educate students on where they'll be in the environment, where they can access emergency service in case of the event of a crisis, where is the nurse located in case they need to speak with them, and more importantly, where are the doors located so they can get in and out of these units. Who regulates the integrated healthcare system? This is a question that gets brought up a lot by students. It's also very important to be mindful of rules and policies when you have students at your site, because you want to make sure that you're instructing them on the correct, legal, ethical way of working with patients and working with staff in these settings, because things can get very complex very quickly. So the two main guiding entities for inpatient integrated healthcare are the Centers for Medicare and Medicaid Services, also known as CMS, Texas Administrative Code, which you'll quite often refer to as TAC. And just so you know, the hospital where we work, we go through a triannual accreditation with Joint Commission, and we successfully completed that in 2018. It's very important to be at a site, students and supervisors, that is accredited, that has passed a standard of care for the patients, for the clients, whatever kind of population you're working for. And the next thing we have, guys, is something that y'all all might be familiar with, which is HIPAA. Which is the Health Insurance Portability and Accountability Act, a 1996 federal law that restricts access to individuals' private medical information. Okay, guys, so on this slide I have a HIPAA quick reference, and here it kind of just goes over when authorization is acquired, when it's required by law, and when no authorization is needed. And what I want y'all to notice is on the bottom of that list, it says treatment providers. No authorization needed. So whenever you're working in the integrated setting, everyone is a treatment provider. Your nurse, your psychiatrist, your counselor, your student, everybody is providing care to this patient. So there is no need to sign authorizations for everyone that is coming in contact with that patient or client. Communication. Communication is vital. It's important. It's necessary. It happens between all treatment team members, and it goes on verbal and nonverbal. It reaches as far as adequate documentation, and it's important because this setting is not concrete. There's a lot of fluidity going on. There's a lot of changes, a lot of things happening at a very high rate of speed sometimes, and so it's very important to be able to communicate effectively and understand the different methods of communication. Communication styles. Verbal versus nonverbal. So once again, we're going to go over kind of more in detail about these communication occurrences and give a little bit more explanation on the verbal and the nonverbal. Verbal communication. Verbal communication in the integrated setting, I have identified two different types. One of them I call rounding, and this is where the doctor and the treatment team meet with the patient on a daily basis. Different things are discussed at this time. I mean, it could be projection of discharge, it could be medication adjustments, management, maybe how they're progressing in the individual counseling sessions with the counselor, how they're progressing in groups. And this is very important to know because right now, during rounds, you get a clear picture of what's been going on with the patient since they arrived, and a clear understanding of what the plan is, and make sure everyone's on the same page. And this is definitely not a time to be shy. I encourage students and staff to speak up during these times and share their ideas, share what's going on with the patient, because, you know, it takes a team to really care for individuals in these settings. The other type of verbal communication that occurs a lot in the integrated setting is staffing. This can be a formal, informal discussion of patient progress or updates, and this can happen throughout the day. A lot of people might think staffing happens at one time in the morning and that's it, we're done. But no, staffing can happen at any time, because like I mentioned earlier, things are always changing in this setting. And so what you're doing during staffing is you're identifying acute medical and social needs, and you're also problem solving as a team. You know, maybe one counselor's approach wasn't working with this individual, or maybe someone has more experience with this type of patient client, and they're able to give that information over to someone else so that they can be more effective in the treatment. With students, staffing happens quite often because they're new, they're learning. They're going to have a lot of questions. I mean, this is totally brand new to them. They're going to want to know, you know, well, why did they act like that? Why did they say that? You know, and a lot of times, just letting them know, or maybe giving them what your experience has been with patients helps so much during this time. So now we're going to go on to nonverbal communication, and this is documentation on paper or in an electronic medical record, which usually becomes part of the permanent medical record. One thing to keep in mind is all of our documentation that occurs, that goes into the permanent medical record, follows CMS standards. There's often different things that students will do, such as like psychosocial assessments or intake assessments, or even documentation of progress notes for groups or individual counseling. And these notes have to follow a certain standard in order to meet CMS guidelines. So that's very important to inform the students of. A lot of times I like to send an email or give them examples of this type of documentation communication. I also explain the importance of why we document this way. And this kind of documentation can also be read by others, so I always let them know, you know, how important it is to document accurately and appropriately. And when they first start documenting, this is for supervisors, I usually have them do it on a Word template, and I read over, and then we enter it into the permanent record. That's just to avoid any errors with patient care, or maybe errors in documentation, and that way we know that they fully understand what it is that they're putting into this permanent record. But yes, nonverbal communication is used to communicate with doctors, nurses, and everyone else in the treatment team. So you want to make sure that you're very clear. And one thing I always tell students is that you want to pretend like you have left the building, you're not coming back, and somebody is picking up on your case, and they should be able to read these notes and get a very clear understanding of what's going on with this patient, and what needs to be done to continue with the treatment of that patient. What will be my role as a student in this setting? That question comes up a lot. There's so many things going on in the integrated setting that students so often wonder, you know, what am I going to do here? What role will I play? How important will my part be? And so student roles come down to these four things here, which is collaborate with the team members on patient progress and needs. This could be talking to the psychiatrist, learning how to approach the psychiatrists and nurses, leading and co-leading individual and group counseling sessions, develop treatment plans, psychosocial assessments, and intake assessments, and then basic knowledge of Texas Administrative Code, CMS, and HIPAA. The learning process. Each student has an individualized plan based on their previous mental health experience and knowledge of the healthcare setting. Student growth is encouraged on all levels of the learning process. Instruction and daily supervision is performed as a team due to the complex nature of the integrated setting. Role-playing and modeling are key components to students developing confidence to work in this setting. Groundwork is established and implemented for each student on time management and quality of patient care. The end goal of the learning process is for a student to be able to perform the same job duties and functions as if they were a regular employee within the counseling discipline. Learning process. Learning process I can break it down to 3 different sections for you. It's initial exposure, working with high level of supervision, and working independently. Initial exposure, students will become familiar with surroundings, patient populations, and the processes for specific units. This kind of allows the student to become more comfortable with where they're at, what they're doing, maybe and getting a good idea of what they want to do. I also allow for students to read through medical charts to get an idea of what kind of patients are you working with. What kind of possible interventions could you be using in the future with them. How does what you're learning at school blend in with this setting. Working with high level of supervision is the second part of this learning process. And this is where students will interact with patients and other members of the treatment team, but have a licensed staff present on hand for questions, guidance, and sometimes even support. It's difficult for some students, and it's common to have some apprehension, anxiety about working with populations, difficult populations, or even working as part of a team. Students identify strengths and weaknesses that they encounter with patients, the setting, or the multidisciplinary team. And on the third, working independently, this is, where we ideally want every student to be by the time they leave the site. Students work with patients independently. Their therapeutic models are discussed. Students are allowed to utilize their own styles and combination of therapeutic interventions, and this can be in group and in the individual setting. Students discuss with supervisor or nearest licensed person the intervention used, the outcome of treatment, plan, goals, and referrals made to the community. Supervision process. This happens at all stages of the learning process, and I always make it known to my students they can communicate with me at any time regarding any kind of issue that's going on in the unit, whether it be with patients, staff, personal. I also like to discuss barriers, short-term goals, really know what my student wants, where they want to go, and if this site is really for them. Supervision process is broken down into 3 different sections, which is observation, initial exposure, and working independently. So in the first observation, students identify barriers between the patients and the multidisciplinary team. They get an idea of how they'd want to work with patients. Initial exposure, students identify what their strengths and weaknesses are that they're encountering when they're working with patients or other multidisciplinary team members. Students also can role play during the initial exposure phase with their supervisor and get an idea of how they might want to approach a patient or another member of the team. The last supervision process is working independently, and this is where students are actively working with patients by themselves. And then they're also speaking with their supervisor or nearest licensed person if I'm not readily available for the intervention used, the outcome of the treatment plan, and any referrals made to the community. What are some of the challenges of working and supervising and being a student in this integrated setting? The first one is difficult population versus lack of resources. The second one is apprehension of working with a multidisciplinary team. The third one is the non-traditional therapeutic setting. And the fourth one is environment. Difficult population versus lack of resources. This is kind of where you might feel, and the student might feel, that they're running into a brick wall. A lot of the patients might be resistant or intimidating to work with at times. There are often lack of resources for individuals within our community here, and I know for those that are leaving the hospital, there's not exactly a plethora of resources out there. So what ends up happening is we get a repeat of individuals coming back into the hospital. The multidisciplinary team. So each member has different tasks assigned to them on a daily basis, and they're extremely busy at times, which can hinder that verbal communication, which means that sometimes the students might not be able to get all the answers they're looking for at that time. Rounding is usually done in the mornings and does not accommodate all of the student schedules. Education and experience level of some members in the team can intimidate students from communicating with that team member. And it's usually the doctor, the nurse, you're coming in as an inexperienced student talking to someone who's been doing psychiatry for 20 years, and it can be a little intimidating. Non-traditional therapeutic setting. This is very different from what a lot of students are taught in school. They are usually informed of counseling sessions that occur on a one-to-one basis, where you're meeting with the patient or client for anywhere from 6 weeks to longer. Treatment plans are developed in the first or second session. In our setting, it's a little bit more fast-paced in that. Visits are usually 2 to 3 days in the inpatient setting. So this is very important to inform the students of. Now, they might have a hard time adjusting to that or learning what kind of interventions to use in these fast-paced environments. So, in the environment, we have spacious units that result in difficulty finding the tools or persons needed to perform tasks. I mean, not everything is in the same place for every unit. So the environment also is loud and chaotic at times, and that's due to those on the treatment team and patient volume. So I don't know if you've ever worked in a setting where there's a lot of noise going on, but it can be difficult for people that have never been in that setting to focus or to know what they need to do next, or if they're documenting, it can be very distracting. How are these challenges addressed? These challenges are addressed by the supervisor and the student having a very open discussion. They're allowed to talk about these difficult things and ways around them. Maybe, what they have control over, what they don't have control over, how to be positive in a stressful work environment. And that's usually, maybe tips that I give them. Other staff members could possibly give them those too. And so it's very different for each student, but these are the key components of how we overcome these challenges. In ending this presentation, we covered a lot of different things that occur in the integrated setting as a supervisor and as a student. One thing to remember is that the experiences that you have as a student in this setting allow for tremendous growth, whether it be in the traditional or non-traditional setting. It's something that you can hopefully take with you and apply for years to come. Working as part of a team is something that I feel that most of our healthcare system is going towards, gearing towards. And I really appreciate your time to this presentation. Thank you.
Hi there, thank you so much for being here today. We're really happy to have you here as part of one of our Tex-CHIP webinar presenters. You presented on supervision within integrated settings, so thank you so much for doing that and now being a part of our discussion. Why don't you tell our viewers a little bit about yourself and maybe the setting that you work in?
Okay. Well, my name is Lara. I'm an LPC and I currently work at Chris's Small Memorial, but actually for the contract company that does psychiatric care, which is Care Integrated Behavioral Health.
Okay.
I have been there for Going on 6 years. Prior to that, I did work in the outpatient setting with community mental health at Coastal Plains for about 2 years.
Okay, awesome. And so I think that one of the first things I kind of want to start out is your experience. So prior to working at your current setting, did you have any experience before that working in an integrated setting, or?
Actually, when I did my practicum, I did do my practicum at the same hospital that I currently work at now.
Oh,
so
awesome.
I was there for about a year.
Okay.
So I did have some experience working as a student, obtaining my master's. So yes, I had.
Awesome. And so can you tell us a little bit about sort of the differences between working kind of at an outpatient setting and then somewhere with such a high level of integrated care, what the differences were in that kind of setting?
I found the difference was there's a lot of teamwork that has to take place, a lot of communication as far as, it's just not you in that setting, it's you and all these other people that are caring for one person
Right.
or a whole bunch of people in the unit. So it was a lot of teamwork for sure.
And did you find that transition, even going as a graduate student into a different setting, more of an outpatient setting, did you find that transition was very different, or did you find it an easy transition when you were doing that?
I found it to make my experience on the outpatient side easier.
Okay.
I was very comfortable with doing what I needed to do in the outpatient setting. And so I felt like I learned a lot as a student in that integrated setting, and then I applied that to my job as, when I left school.
Okay. And as far as your supervision experience, did you do your supervision kind of practice in an integrated setting as well, or was that a transition that you had to make too from an outpatient to an integrated setting from a supervision perspective?
From a supervision perspective, it was more of, I guess, of a transition that I had to do.
What were some of the challenges that you encountered in that experience?
As doing the supervision for
Yeah.
students? I experienced a lot of students coming in and not being familiar with working in that setting, maybe not having interventions or therapeutic models that were discussed at school that were applicable to the inpatient setting. And also just kind of maybe the whole shock value of working in that setting, because there's a very acute population that we serve.
Right.
They're very psychotic at times, very suicidal, and sometimes students were very uncomfortable with discussing suicide and what happens, or what or things of that nature.
And so as a supervisor, having to transition into working in that integrated setting and going through those challenges yourself, how did you approach working with students who had those challenges, so that way you could kind of combine what your supervision experience with this new setting?
I always found myself referring back to when I was a student and what it was like for me, and then talking to the student about, okay, so these are challenges I face, like what are you facing now that you're coming into this setting? What are some of the things that you're seeing that are maybe barriers to you learning or working with this population?
Right.
So a lot of it was just really trial and error of talking, because there was no guide to supervising students or knowing what to do. It's like, okay,
there's
so
no
here we
paper
go,
that says,
and then
now you're an integrated
so I referred
setting.
back to what I used to do
Right.
and how I learned, which was a lot of observation, a lot of modeling, a lot of reading, a lot of watching the interactions.
Okay, awesome. And so would you say that you had a better idea of kind of the unique role of a supervisor in an integrated setting, and it is quite different?
Yes, I would say yes. I had a really good idea of what it was like for the student, as well as what they needed to learn to be successful.
Right, absolutely. Awesome. And in your presentation, you spent a lot of time discussing communication. So can you tell us a little bit about the level of importance of communication when you're working in an integrated setting?
Yeah, communication is vital. It's it's the air that you're breathing when you're working in that setting.
Right.
If you're unable to communicate with the doctor, nurse, even a mental health tech, you're gonna potentially hinder patient care or hinder your growth. Because one thing can happen in the morning and then change in the evening. And if you're not communicating with the staff that's caring for the patient, or you're not relaying a message to somebody, hey, you could be letting a suicidal patient leave the next day.
Right.
And they made an outcry to you, but not to everyone else on the team. So it's very important to be able to verbally communicate as well as document thoroughly, because like I always tell my students, you want to make sure that you're leaving a picture of how what's going on with this patient. That way, in case for some reason you don't come in the next day, the person who's following you can pick up on this case and kind of know what's going on.
Right, absolutely. And could you tell our viewers a little bit about what that communication looks like in an integrated setting? I know you mentioned there's a lot of different practitioners, there's a lot going on. So what in a typical day, what does that communication look like?
Oh man, in a typical day, there are rounds with the psychiatrist in the morning, the nurses, so you're there as part of the team. Everyone's, seeing these patients together.
Right.
You're discussing things that happened the day prior, maybe in group or in an individual counseling session. And then as the day goes on, you're doing like what I call staffings with not only other counselors, but with nurses, with mental health techs, on patient progress throughout the day. And then of course by the end of the day you want to have all your documentation in, whether it be something like a psychosocial assessment or a group note. You want to make sure that you have everything in. That way the night shift can go in and read your notes also. And then that way you can use them as a reference for the morning. So there's the formal staffing happens in the morning, and then it's kind of informal as the day goes on.
And do you find that everybody within the integrated team has a sound idea of their roles and responsibilities, or is that something that's still a challenge daily, kind of making sure that everybody is working in that collaborative?
For the most part, a lot of our nurses have been there for a while, our psychiatrists have been there for a while, they're familiar with their roles. Our counselors have now been there for a while. We actually have hired quite a few of our students to work in that setting. And so they're pretty familiar with their roles as long as they're on the unit, as long as they know what unit they're on.
Right.
Now for students, it's pretty easy for them to identify their roles, because I tell them from the beginning, okay, this is the unit you're going to be in, this is the unit what you're going to be doing here, and so this is what we're doing as you go on during the weeks. And if they move to a different unit, I'm sure to tell them what they're going to be doing, what their responsibilities will be, and then I usually have like a lead on the unit that they're going to, and then that person is someone that they refer to if they have a question about, am I doing this right or am not. And the main thing we focus on a lot for the inpatient setting for students is you're going to be focusing on groups, individual counseling, and then psychosocial assessments and developing treatment plans.
Right.
So.
And then just kind of pushing that idea of being sure to be communicative with everybody and kind of be collaborative in that approach to care. Awesome. And so kind of piggybacking on that, how important are things like group cohesion within your team and within the unit that you're working in?
Oh, it's very important. It's one new person can totally disrupt that cohesion, and then you got to bring it back together. So sometimes it's more challenging for that group than the actual patients that we're doing group with.
Right.
But it's very important. It's very important to communicate with everyone, and not necessarily like everyone, but to be able to communicate on a professional level.
Right.
And always keep in mind that this is for the betterment of that patient. So it takes practice, and when someone new comes in, it's difficult sometimes in those settings for the nurses, the doctors to accept a new person coming in and to communicate with them. And what I always tell the students is, just keep on communicating. Make sure what you're saying, what you're saying, know what you're talking about before you discuss that with someone.
Right. And so that would kind of, from a student perspective, ease that transition. Yes. And so that's kind of the advice that you would give as a supervisor.
Yes.
Awesome. Okay. And so when you are thinking about things that you could tell incoming students who are interested in working in an integrated setting, what kind of recommendations do you have for them if they are new to the field, they're coming in and they are wanting to get involved in an integrated approach? What kind of things as a supervisor would you tell them?
I would tell them to be prepared for a really fast-paced environment, really a non-traditional setting from anything that they've learned in school, or maybe they've even seen on television. Because what do you see on TV a lot? The counselor, the desk, one individual client,
quiet,
yeah. It's not that. So I always make it a point to tell them that this is not what it is. This is totally different. Some people like it, some people don't like it. If you don't like it, let me know. Be sure to discuss that.
Right.
If this is not what you had in mind. Also, take advantage of every opportunity that you have to work with these patients and clients and even the staff, because these are things that you can use later on when you leave this site.
Right.
So I always tell them to keep that in mind. It's going to be hard at first. It's going to be really overwhelming at first with all this information coming in. I said, but as time goes, as you practice more and more, you'll become more comfortable in this setting. So I always encourage students too that are coming in, like, hey, if you can spend an entire 8-hour day here with me, that's great. If you want to come see the site before you actually start working, that's even better.
Right.
That
so
way
they
you
have
can,
an idea.
Yeah, that way they can have an idea. Is this really for me or not?
Right.
So I'm pretty selective on what their background is, where they're coming from, or can they handle it. I'm very honest with what they're going to be dealing with on
Right.
the unit. So that I feel like that's a big part of the advice is just honesty and letting them know really what's going to happen.
What that expectation is, and kind of what's going to be, what their role is going to look like. Awesome. And so how about from a supervision perspective? So if we have supervisors watching this who are currently in the process of transitioning to an integrated setting, what kind of suggestions do you have for supervisors in being in ways that they can be the most effective supervisors in a new integrated setting?
I would give them the advice of just being very open with their students. Like I said, open and honest, and communicate with their students on a daily basis. And also don't be afraid to acknowledge, like, what are the barriers? What is hindering us from giving this kind of care, or hindering the student from learning? Because when they're not acknowledging those things, it seems to the student as if, I feel like it disconnects the student from the whole learning experience. So in order for the student to learn, I would really encourage supervisors to be open and honest about the processes, about the challenges, because we don't live in a perfect world. No
Right.
setting is perfect. Nothing, there's flaws everywhere. So.
And what about specific challenges within the integrated setting from a supervision perspective? Have you found that you've kind of encountered very specific challenges in that setting that maybe they wouldn't go through in an outpatient?
I feel like, I do feel like the challenge for that is the fast-paced environment.
Okay.
It's difficult for some students to move at that pace, and to want to move at that pace, and to be comfortable moving at that pace. They might feel like they're doing something wrong, or they're just not ready yet.
Right.
And so that's a challenge that I see a lot. Apprehension about their clinical skills in that setting, because they've been taught to do individual counseling. This is where we go, and in this one you're pulling from everywhere,
right?
To help these patients. So I've seen that as a challenge with students coming in. I'm trying to think of the other ones I've seen, and a lot of it too is also time management is very important in that setting. Of course, fast-paced environment, working with all these different people and trying to get it all done.
Right.
And I think also too, maybe sometimes their expectations are not matching what we're doing. They think that I guess the workload sometimes is a little overwhelming for them.
Okay.
When you have 22 psychotic patients on an inpatient unit, it can be overwhelming for a student at times.
Right. Okay, awesome. And I think maybe the last question that we can kind of close out with is, what are some of your favorite parts about working in an integrated setting?
Okay. My favorite part is actually really helping the patients and families that are like at their wits' end, haven't exhausted all of the resources in the community, and they come to the hospital and they need placement or they need direction, and really, guiding them in the right way, helping them, and making a change in them that is lasting, and doing it in a short amount of time.
Right.
It feels like you're working against the clock, but at the same time you're making a difference in someone's life. Nobody probably ever intends to go to a psychiatric hospital or be in there or need to get help that way, but to be there in a time of need and time of crisis for families and for patients is really what I really love about working in the inpatient setting.
Fantastic. Well, thank you again so much for being here. We really appreciate your insight, your wisdom, and your discussion. So thanks again.